this back on time. I'm going to try every attempt here to do this. So today what I was asked to talk about is fentanyl and some of the myths or misconceptions out there about this. I used to do a talk about 5 or 8 or 10 years ago called Opioid MythBusters, and Opioid MythBusters, and talked a lot about misconceptions just about opioids in general for pain relief, and some of the things that have now kind of been pretty well understood, hopefully, over the last decade. And now the same kinds of things are popping up, obviously, with fentanyl. Lots of questions about it, and some of them are actually misconceptions about it. So I think it's good to talk a little bit about this thing. As you know, you've heard the numbers. Drug overdoses are at an all-time high in the United States. Over 100,000 of them in 2021. Those are the reported ones. Everybody will acknowledge in public health, that's not all of them. These are the ones that are reported and documented and that we understand. The number could be as high as 300, 400,000, depending on those small area studies that are done from coroners that do autopsies on everybody in a county for a while, just to see if our counting is off. Guess what? It's off. And guess what? The number's a lot bigger. So it's already scary, but it's probably much, much larger than we're even hearing. Fentanyl's now involved in about 2/3 of these deaths. You heard earlier from the data people that there's a new code to specifically indicate fentanyl that did not exist prior to 2021. Some of this increase could be because the code is now available and it wasn't before. So the jump, this may have been here sooner is my message. Not that it's not an issue, it's just that this may have been here earlier, we just didn't have a code for it and we weren't testing for fentanyl. 5 years ago, we didn't even think about it. Now we do. Now we test more often. So the numbers were probably coming up before. Now it's just really, we're getting a much better lens into it, which is important, obviously. So fentanyl, what is it? You heard earlier, it's a potent synthetic opioid. So it's man-made. We started with opium, 1849. Somebody was smart enough to take opium tincture and turn it into morphine. So doctor, his wife invented the hypodermic needle. So lo and behold, now we have morphine and injectable morphine in 1849. In 1898, somebody took morphine as though it wasn't potent enough after the soldiers' disease of the Civil War. So we need to make something stronger, so they created heroin at Bayer Pharmaceuticals in 1898. And then the next most potent one came fentanyl in 1960, was synthesized in a laboratory in 1960, FDA approved in 1968 for use in operatory settings and for acute pain and surgical and acute operatory kinds of settings. So fentanyl is a very, very good drug. It's very potent, 100 times more potent than morphine, 50 times or so more potent than heroin. So very, very potent drug. But again, it's not new. People say this is a new thing, and it's not new. It's been around for a long time, so longer than I have, and I'm old. Only one person in the room older than me. Where's Jose? He's older than I am. Everybody else in here is not old. Just myself and Jose are. But it appears in many ways, shapes, and forms. You heard that earlier. So it's increasingly dangerous. And I've told people it's not like the game has changed. The game is the same. Opioids have been around in the opium wars for thousands of years. This is not new. The stakes are higher. It's like playing Russian roulette with 1 bullet in a 6-bullet chamber and saying you're playing Russian roulette when you take something you don't know what it is. Now fentanyl has increased this to 3 bullets out of 6 in the chamber. So you got a 50-50 chance almost of dying from a fatal, non-fatal overdose. Those ratios now are in much, much more severe. So the stakes are much higher. The game is the same. So addiction and opioid treatment and all the things you hear about with treatment, it's more challenging. The potency of the compound is much more robust. So why is it important? Again, stakes are higher. More potent drugs leads to more deaths, more opportunities. People are understandably frightened about this. And you hear about it now. But there's a number of misconceptions that the fear, unfortunately, does lead to some misconceptions and mythology that kind of gets out there that people start to see and hear and believe that isn't backed up by the evidence. And so I always go for, what's the science say? What do the toxicologists say? What do the pharmacologists say? The pharmacists that work with fentanyl on a daily basis and in the work they do, and they mix it and handle it and do all these things, talk to these people and find out what the truth is about the compound. Good news, we have a lot of information. So I'm going to cover 5 myths really briefly. Here, probably among the more common 5 myths. First is that simply inhaling or touching fentanyl can make you high or cause an overdose. Not true. Just flat out not true. Fentanyl is actually very difficult to force through your skin. Yeah, the pharmaceutical industry started in 1968, was synthesized in 60, remember that. Started launching in 1968. It took them until 1990 to figure out how to put it into a patch form that if you put it on your body and it sits there against your skin for 15 minutes or so, can create a concentration gradient to force a little bit of fentanyl through your skin, hydrate your stratum, get into your stratum corneum, build up there, and then start to dissipate into your bloodstream. So it's, you have to force it to your skin. And two interesting things that I've read about this one. One is the American College of Clinical Toxicology. So the toxicologists and pharmacologists have studied this and said, if you covered your hands in fentanyl patches, wrapped one around each of your fingers, that's 10 patches, put them around the palms and backs of your hands, you get about 15 patches on your skin, and leave them on for 15 minutes, you can get about enough dose for 100 micrograms of fentanyl, which is a pre-op dose that I got before my appendectomy about 3 years ago. So it's 15 patches for 15 minutes. Gives you a standard dose that won't overdose you. And that's using all the modern technology we've got to try to force that drug into your body through your skin. So people that say, I touched fentanyl and got an overdose, no, you didn't. It's impossible. My second favorite one is a friend of mine who's a pharmacist up at University of Wisconsin-Milwaukee, was working in the hood making fentanyl bags. He's mixing fentanyl, he has a concentrated fentanyl liquid, pharmaceutical fentanyl. Spills this accidentally, because pharmacists are both nerdy and klutzy. That's two job qualifications of which I can attest to. So you have to be nerdy and klutzy. Spills the fentanyl on himself. He has an abrasion, a scrape, and a cut on his open hand. Has a picture of this, coated liquid fentanyl on his hand with the abrasion and the cuts. Washes off the fentanyl, goes to the ER, nothing wrong, fine, goes back to work. Like if that doesn't put the fentanyl through your skin, it's not getting through your skin. So what it really takes is a needle or to snort a large enough quantity of this to be able to absorb into your system to do it. So it really takes some doing. So people say the incidental contact, that stuff that's sitting on the table, or there were particles in the air and I inhaled enough of this to do that. All of those things that you hear, doesn't work. Doesn't work, can't work. That's why if I ask me would I go into the room, sure, I probably shouldn't be going into a room where they're mixing drugs and donuts. I probably shouldn't be there in the first place. But would I be afraid from an environmental perspective or for a fentanyl overdose? No, that would not scare me. Myth number 2, you heard about this earlier, all fentanyl is the same. So it's all poisonings. That's the other corollary. All of this is a poisoning. Not true. You heard earlier, which I appreciated on that slide, pharmaceutical fentanyl is an important compound. I really wanted to have it when I was about to get myself cut open for my appendicitis. And I really wanted that when the anesthesiologist said, here's what I'm going to do with this propofol and with the fentanyl. I said, good, because if you're going to cut me open with a knife, I want to have that on board. But only in the operatory setting so they can take care of me that way. I don't want to take any of that home with me, nor do I think that's a good idea. But it's not all the same. So there's pharmaceutical fentanyl that we should not be discouraging use of this in proper settings under proper environments. Fentanyl is not inherently bad. It's FDA approved, it's safe and effective. But illicitly manufactured fentanyl that is put into things that people don't know that it's there, that is contaminant, that is poisoning, that is a problem. And we're talking about all of these issues together. So if someone just says the word fentanyl, you just have to ask them, what do you mean? Where did they get it? What are we talking about? That's the important thing, to not conflate them and get them together, which I appreciated that point being made earlier. Myth number 3, I hear this all the time. Standard precautions for dealing with suspicious substances do not apply to fentanyl. I need a hazmat suit. I've seen this one. I need a hazmat suit to walk into that room with fentanyl. I said, no, you really don't. And B, you just spent a lot of money on hazmat stuff. You probably freaked everybody out, right? Because you think this is hazmat, but it's not. It really is not hazmat worthy. You're probably just going to get yourself really hot and sweaty and muggy and not breathing so well if you're in a hazmat suit, which is going to contribute to one of the next myths if you do that. But don't buy it. The toxicologists say nothing is probably required. If you want to be on the safe side, basic nitrile gloves. That's it. And the toxicologists say that. And whatever the American Society of Clinical Toxicology says, follow it. And you want the science, you want the nerds that all they do is this, follow those nerds. I always look for the nerds. Like I don't do electrical work in my own house. I don't do plumbing work in my own house unless I want to burn the house down or flood the house. But follow the right experts. Those are the people to follow. That's who we teach in the pharmacy school. We follow those folks. That's why the pharmacist didn't freak out when he got fentanyl poured on his skin. Just washed his hand off and went back to work. So it's easy. So it's just standard precautions. You would probably wear gloves. You would probably take standard precautions, but standard precautions are fine for fentanyl. Myth number 4, feeling sick after encountering a powdered substance is a symptom of fentanyl overdose. And this one is coming around now where people say, oh my God, somebody touched something, didn't know what it was, They got, their heartbeat was racing, their heart was pounding. They got, they were like anxious, they were freaking out, and they passed out on the ground. We gave them 4 doses of fentanyl, and after the 4th dose, 3 minutes later, Narcan, 4 doses of Narcan, 4 doses, and finally, 3 minutes later, they finally woke up. And ipso facto, this was a fentanyl overdose. Except, no, it's not a fentanyl overdose. And interestingly, so a couple of these case reports, one of them from California, they took blood from one of these officers and nothing in the bloodstream, no drugs of any kind. So it wasn't fentanyl. If it was fentanyl, the Narcan would have worked. 4 doses would have worked. Those symptoms aren't consistent with a fentanyl overdose. If your heart is racing, that's adrenergic response, fight or flight, that kind of thing. Fentanyl is going to slow your heart rate, slow your breathing, gradually you'll overdose, you'll fall asleep more, as that's the way it looks. Someone's so asleep that you can't wake them. That's how they are. The symptoms being reported are really kind of the symptoms of a panic attack, an extreme anxiety attack, which I don't doubt. Those symptoms are real, but it's not the fentanyl, it's panic about fentanyl. So I would say fentanyl panic disorder may be a new subclassification of something in the DSM-5. That may be a subset of panic disorder due to fentanyl. I don't doubt that for a minute, that there's a lot of panic about fentanyl. But fentanyl didn't cause that overdose like that. And the only way to find out for sure is draw blood. And if something was that much fentanyl was on board to require 4 doses of Narcan, it would work. Take the blood sample, fentanyl will show up if it was that much. So the only way to know for sure is if anyone says that they had these symptoms and they're convinced it was a fentanyl, get the blood test if somebody is want to find out. And you'll find out if it really was fentanyl or not. Probably wasn't. And the last one, myth number 5, which is a dangerous one that I want to dispel quickly, is that Naloxone or Narcan does not work on fentanyl overdoses. It absolutely does. Fentanyl is an opioid. Naloxone works on opioid overdoses. If somebody has a large amount of fentanyl in their system, it may require additional doses of Naloxone. It's dose dependent for sure. So it's possible if somebody has a large amount, they may need a 2nd dose of Naloxone or even a 3rd or a higher dose amount. If an EMT shows up, they'll administer a certain amount, monitor response, and be able to do this if they're a paramedic. Paramedics have been using this drug for 50 years and will almost use it to diagnose somebody's unconscious. Give them Naloxone. If they're not responding, it's probably cardiac. If it is responding, it's probably an overdose. And it's really very not dangerous to give. So I don't want to do anything to discourage people from having Naloxone available, using it. It's virtually harmless compound. I used to do the trainings for Naloxone and do that with fakes, and we ran out of the trainers that were the saline. Oh, give me a real one then. Give me Narcan. Just what the heck? And so I did that. I've done that 4 times in the last 10 years with Narcan. I can tell you it's no difference in symptoms from having saline squirted in my nose. If you don't have any opioid on the receptors, you won't feel any change. It'll go sit on the receptors for a while and then leave the receptors, but it's a pure antagonist, doesn't do anything. All it does is kick the golf ball off the tee, if we're going to use that analogy earlier. That's all it's going to do. It's a big bad bully, and it kicks the ball off the tee, and it sits there. Yeah, it hits the ball. It's like a big giant Big Bertha, right? And Naloxone is like, boom, we're going to knock that thing out, or your driver of your choice, the big ping driver, whatever you like, if we're going to play golf here. But it knocks the golf ball off the tee and sits there instead, just long enough for hopefully someone to get into acute medical care, whether it's EMS or the emergency room. So absolutely don't want this to discourage people when they say it doesn't work, so I'm not going to use it because this could be fentanyl, so I'm not going to go in that room and I'm not going to use Naloxone. And those are the 2 biggest ways we're going to lose more people, is don't intervene and don't try giving Narcan. You want to see 107,000 go up even more? We have to think the opposite. I'm charging into these opportunities because the fentanyl's not going through my skin because you can't even force it through my skin. And I am going to run in there with this nasal spray, and I don't care if I give it CPR, and I'm just going to be squirting nasal spray in everybody that moves. And I'm all about that. We will save more lives erring on that direction, overusing Naloxone, than underusing it. And that's the danger of some of these myths, is we just don't want to have these things get in our way of providing good harm reduction or getting people into addiction treatment services that need to get into services. So thanks very much. I appreciate your time.